Directives are essential to effective care of an individual in both crisis and end-of-life situations. Keeping these documents current and updated is even more important. However, only approximately 30% of adults have completed an advanced directive in the first place. My proposition is to spread the word regarding advanced directives, what they are, and how they help. Increase the number of individuals with current working advanced directive documents. Encourage local primary care providers, family and friends, and patients seen to examine the state of their health and their views towards advanced directives and end-of-life care decisions. To advocate for reimbursement for advanced directive discussions with your primary care providers. And secondarily, behind all of that, reduce the stigma of death and dying and making decisions regarding acute care and end-of-life issues to make those less awkward and uncomfortable in general. An AHRQ-funded study showed that conversations with doctors about advanced directives planning led to an increased satisfaction among patients aged 65 years and older. Patients who talked with their families or physicians about their preferences for end-of-life care had less fear and anxiety, felt they had more ability to influence and direct their medical care, believed that their physicians had a better understanding of their wishes, and also indicated a greater understanding and comfort level than they had had before that discussion. Advanced care planning in general includes thinking of and communicating about a lot of things, and it can address a lot of issues for certain individuals. What care is most important to them and why, what kinds of medical conditions they would or would not want treated, what kinds of treatments they would or would not be willing to endure, and the kinds of outcomes that they would wish to live with, including specific disabilities from acute crises. And finally, who they would want as a spokesperson for them if they could not make their own medical decisions. All of these would be evaluated and taken care of with the discussion of advanced directives. Simply taking the time to discuss advanced directives and end-of-life issues with your family and friends and other professional colleagues would be a step in the right direction of increasing awareness and decreasing the stigma associated with death and dying. So my proposition is to make your wishes known, and others will follow you in your example. Thank you for your time.